Hey, hey, hey. Hello, good afternoon. Happy, in San Antonio at least, happy, slightly dreary, slightly wet looking, almost like it's going to rain Sunday. Hello, hello. It's 2 p.m. So if it's 2 p.m. Central Standard Time, it's time for Ask Dr. Lulu. Hello, hello. Hi, Mandy. My little man is on number one today. Yay. Hi, Tammy Flynn. Hello, hello. Hi, everyone. Happy Sunday. Okay, so if you're just meeting me for the first time, my name is Dr. Lulu. I'm a board certified pediatrician. I'm a teen expert, mother of two teenagers. That gives me the right to say this, right? And one young adult. I'm a board certified pediatrician. I have to say that again because we're going to talk about vaccines. The numero uno controversial topic besides antibiotics, which I'm gonna try to take that one head on next week. So we're going to talk about vaccines and teenagers, what to do. So if you're joining me on a replay of this video, please let me know where you're watching me from. I love to know that. If you're live, hey, sit down, get a pen. I'm going to need you to write a lot today and let me know what you think by giving me a thumbs up, a heart sign, anything positive. I need all the energy, okay? I hope you guys liked last week's video. I got a lot of comments on that. I thought that was really fun. We talked about Lisa and her brother Bart and her baby sister Marge. So today we're going to talk about teenagers. Yay! More teenagers. And if you're wondering why I'm doing this, if you're just meeting me for the first time ever, I decided that in the past few months that I was going to face head on teens and teen issues, mainly because I discovered in my own private practice, my own little cocoon, I was getting a high number of teenagers presenting to my office with depression, anxiety, bipolar disorder, suicidal thoughts, and even a lot of attempted suicides and cutting and all the things that go with that. And so I decided, if not me, then who? So I'm also a public speaker, if I forgot to mention that earlier. If you have any events going on in the community, if you need someone to talk to a teenager, a bunch of teenagers, their parents, I'm the man, okay? All right, let's get started. Enough of all that talk. Hey, Alice. Hi, Rebecca. How are ya? I miss you. How's my little man? Good, good. Let's get started. Hi, Courtney Pete Veras. I gotta get your name right. Okay, so we're talking about vaccines today. And so if you're just meeting me and you don't know where I'm from, I am a Nigerian by birth, currently naturalized American. And I think that gives me the right to talk about vaccines because I have seen the devastation that vaccines can cause to children who are not vaccinated. I went to medical school in Nigeria. I saw every single disease that I'm going to discuss today firsthand. I saw the complications. I saw the death that it can cause, the heartache that it can cause. I do not take vaccines for granted at all because I was vaccinated, yes, but also because I've seen what vaccines can do. So please, if you're a non-vaxxer, don't make me take off my earrings. Just walk on by and then we can all get along, okay? Awesome. So teens and vaccines. So according to the CDC, the definition of a vaccine is, let me see if I can remember, a biologic product, I'm just going to read it, a biologic product that stimulates a person's immune system against a disease and protects them from that disease. Okay, so it's a biologic product. So three things: is a biologic product, it stimulates the immune system, and it protects against the disease. So can someone please write that down for me? It's a biologic product, it stimulates your immune system against a disease, and it protects you from the disease. Now, I know some folks are going to say, but is it 100%? What is 100% guaranteed except death in this world? Nothing. So nothing is 100% guaranteed, but I'll tell you something. If there's an 80% chance of rain, you're going to get rain. So if we're getting protection up to 80%, sometimes 90, 95, maybe even 99% protection, because we can never really say 100%, I think that's pretty good. So yes, if you know a teenager if you're a mother of a teenager, if your friends are teenagers, if you're cousins to teenager, if you're a teenager, if you're a grandmother of a teenager, holla at your people, invite them to come sit down. I only did the definition. We're talking about teens and vaccines. If you're just joining us, hi, Dorothy. Hey, my girl. Hi, Mata John, Paula Wilson. Hey, everyone. Hi, Paula. How are you? Okay, so vaccines and teenagers. Yes? Good. So a vaccine is a biologic product that stimulates a person's immune system against a disease and protects them against that disease. If you have seen any of the diseases that we're talking about today, write it down in the comments, please. Let's make this thing, hi Naomi, let's make this thing as interactive as possible. So we're going to discuss 9 vaccines today. There are 9 total that I could come up with that teenagers have to receive. 9 vaccines. And yes, you can get them by mouth, orally, you can get them intranasally, you can get them intramuscularly or subcutaneously. So we have 4 modes of delivery. But either way, I know teenagers, y'all don't like needles, but get in line, roll up that sleeve and let's get this thing going. So first thing we're going to talk about today is hepatitis A. Actually, you know what? Why don't I divide it into preteens and teen vaccines? Let's talk about preteens. So for preteens, I'm going to do 9 to 11 and then of course, regular teens is 13 and up. So the first vaccine is going to be hepatitis A. I'm going to talk about hepatitis A. It's a really easy one to talk about. It's a virus. Hepatitis A is a virus. It doesn't cause too much drama when you get it. So it's one of the mildest diseases you can get. Maybe a stomach virus type picture, maybe a little bit of jaundice, maybe some stomach pain, some nausea, a little bit of vomiting, abdominal pain. But for the most part, you don't get really, really sick. Most people will make a full recovery from hepatitis A. So it's a pretty easy one, but we still vaccinate mainly children ages 12 to 23 months. However, we vaccinate teenagers. If you're going to go on a mission trip, you're going to go to a place where there's an epidemic or there's an outbreak of hepatitis A, usually third world countries, but also some inner city areas in America, yes, I'm going to say it, have outbreaks of hepatitis A because of non-vaxxers, right? So if you have an outbreak and you're going to that area to deliver your mission or whatever you're going to go do, please, please, please ask your doctor, Doc, have I received the hepatitis A virus? I'm going to throw it out, Nigeria, for example, or Cambodia, wherever. Anywhere where there's an outbreak or there's a high incidence of the disease, you want to get the vaccine. Mainly, yes, I did say it's a mild disease, but you don't want to get sick, period, right? While you're there for 10 days or 20 days or whatever, you don't want to add sickness to any of the drama you're going to get there. So you want to get your hepatitis A vaccine. I'm going to put that out there. Not to be confused by its more aggressive, angry, not so nice cousin hepatitis B, okay? We're going to talk about that next. Hepatitis B, not a good virus, not your friend virus at all. How do you spread hepatitis A? By eating, by drinking. How do you get hepatitis B? Body fluids. And there have been some studies that have shown that you can get it other ways, but usually it's body fluids. And by body fluids, I mean you can be born with it. So through the womb in a mom who is obviously not vaccinated and who doesn't have immunity or who has the active disease. You can get it through sexual intercourse. I'm going to come out and say it right now. That is true. Body fluids. You can get it through IV medication. IV, well, maybe not medication. Take that out. IV drug use. Cancel medication. IV drug use. In other words, infected needles. IV drug use. In other words, infected needles. So hepatitis A is fairly prevalent. Hepatitis B is fairly prevalent. It's fairly common. Also, if you have a family history of, or rather, if you have a family member who has hepatitis B, you want to get vaccinated against. So if you're going to be sexually active ever, you want to get that. If you know anyone who is into IV drug use, you want to make sure that they get it. Hepatitis B can cause hepatitis, which is basically inflammation of your liver, and your liver enzymes get elevated, you get abdominal pain, you get jaundice, you get sick. And whereas you might recover to some extent at the beginning, a lot of people become chronic carriers of the virus and they become hepatitis B surface antigen positive and they become chronic carriers. That carrier status can cause your liver eventually to fail. You can have liver failure, or you can have cirrhosis of the liver, which is a very, very bad disease that can usually end up as hepatoma, which is a liver cancer. So all around, not a good virus to catch. So you want to get your hepatitis B vaccine. Also, if you're going to go to college, you're going to live in a dorm, and there's high incidence of all kinds of things that teenagers, you guys know what y'all do. You want to get your hepatitis B vaccine. That is the one that you don't want to mess with. Luckily, knock on wood, we usually give it to our kids here in America at birth. Usually you get the first dose at birth, you get the second one within a month or two of birth, and then the third one at 6 months. But really what I do in my practice is whenever I catch you, I give it to you. If you've never had it, I'm gonna give it to you. If you've had one dose, I'm gonna give you the other two. Usually spaced out, of course. If you have 2 doses, I'm gonna give you the third. So I wanna catch up your immunization. So that's what we call catch up immunizations. So hepatitis A, hepatitis B, you wanna get those vaccines, okay? If you're a teenager or a preteen. Okay, what else? Oh my goodness, tetanus. Okay, so the tetanus booster, which is what you get at your age. Hi, Mom. Let me see. Hi, Alexis. Cynthia Mota Vasquez. Hello. Diamusti. Hello. Hi, Naomi. How you guys doing? If you have had any, if you know anyone, I'm going to talk about HPV. Yes, I'm going to talk about that. Thanks, Alexis, for that. Yeah, that's on my list. Actually, that's my last vaccine to talk about today, because that's like numero uno for controversial. So I'm going to talk about that for sure. But so tetanus, so it's the Tdap is what we give to the preteens and the teens. Can someone please write T, capital T, little d, an A, and then a little p. So a little d, a little A, and a little p. So capital T, Tdap, that is a tetanus booster vaccine. You want to get that. When do you get that? Between 11 and 12. So for me, in my practice, really, one of the visits that I never mess with is 11 to 12-year-old visits. That is when they're going into middle school, right? So that is when I want to make sure that I give them all the vaccines that we need for their middle school ages and their high school ages. And then, of course, when they're going into college, the next peak when we get vaccines about 17, 18. So that's why I said preteens is 11, and then, of course, 11, 12, and then 18, 19 is the real full-blown second teen time you get vaccines. So the tetanus booster, you want to get that at 11 to 12. So that visit, the one you just had maybe last month or the month before school started, before you went on to middle school, make sure you ask your mom, Mom, did I get a Tdap? I don't know, Dr. Lulu was saying something about that. Can you just check, make sure that I got it? Why? Because tetanus, yes, you can get tetanus. And it's such a shame that we're talking about vaccines and the need to get vaccines in America of today. It's just unfortunate. But you don't want to see someone who's had tetanus. Has anyone who's watching me seen anybody that's had tetanus before? Let me see who else we have. Counter Cod Mackay. Hello. Hope I didn't butcher your name. Eldon Red Mills. Hello. Has anyone, yeah, so the Tdap, they're together. So has anyone who's watching me either known anyone who had tetanus, seen anyone who had tetanus, or maybe, God forbid, had tetanus? Please holla at your girl. Hi, Jalami. Hey, Dr. Landra, how are you? So we're talking about teens and vaccines today if you're just joining me. So please comment. Diamusti said the person died in Nigeria. Exactly, exactly. Tetanus is so bad. It causes something called spasms you don't want. Oh my God, like you have musculoskeletal spasms, you're stiff, you can't breathe. All of your muscles kind of get shut down. You can see, but you can't breathe. You will probably die if you can't breathe. And I know that's the main thing I want to talk about, because everything else doesn't matter. As long as you can't breathe, you can die. So please get your tetanus boosters. Get your tetanus boosters, okay? Let me see, any more questions? So Diane, thank you for that. Diane says she has seen someone who died of tetanus, y'all. This is real, okay? And then, oh God, meningitis. Like I would have forgotten, right? The meningitis vaccine. You want to get the first dose between 11 and 12. So Diane, I know your son is, I think, 9 or 10. So he's coming up on getting his vaccines. Diane says he got it in an automobile accident. Yes, yes. May so rest in peace. So yes, yes, they do die of tetanus. That is a true statement. So he must have had an open wound and it came in contact with a dirty, maybe infected soil or dirty, I don't know, nail or something. But certainly he got the disease, and they usually die. They usually die. So meningitis. You're talking about death. Meningitis. Okay. So has anyone heard about meningitis? Please holler at your girl. If you've heard about meningitis, holler at your girl. If you've seen anyone who had meningitis, holler at your girl. I have had patients who had meningitis. Luckily for us, though, the more common meningitis that we see around here, at least in America, is the viral type. Still meningitis, still bad, because it's an infection of the meninges, which is the lining of your brain and your spinal cord. So it's still very, very bad. However, there's a bacterial form. Of course, right? We're going to have virus. Sometimes you get bacterial form. The bad bacterium is called Neisseria meningitidis. Fancy name for this crazy bug that causes meningitis, and a lot of times it's fatal. Now, people do survive, that is true, but a lot of times they survive with morbidities. They get deafness, they get blindness. I mean, it's bad. They get brain damage, all kinds of bad things. Cerebral palsy, depending on the age of the child when you get the infection, altogether not good. But if you thought meningitis was bad, you want to try his older cousin called meningococcemia. Meningococcemia, about the time it takes me to say the word meningococcemia, if you catch it, you're pretty much on your way to go see God. That is how almost 100% fatal meningococcemia is. Thankfully, it is rare, but you still get it the same way you get meningitis as far as the bug. The Neisseria meningitidis is the same bacterium that causes it. So yes, if you get meningitis, you might survive that. Usually you don't, but if you get meningococcemia, baby girl, baby boy, you're not going to survive. That's how bad it is. Who gets meningococcemia? Who gets meningitis? You ask me. Everyone, but especially if you're going to live in a closed environment like where? College, right? Yes. So you want to get the first one, you get 11 to 12, and again, you get a booster about 16, 17 on your way to college. You get the MemB, I think is the one you get. So meningococcemia, it's, I think, universally fatal after 12 hours. 12 hours. 12, maybe 24, but definitely within 12 hours, you get shock and you're out of here. It's not a good thing. Have I seen someone? Absolutely. I have seen a patient, of course we lost them, who had meningococcemia. You don't have any reaction time. And I think, honestly, the problem with America of today is lack of memory. Y'all don't even know anything about these diseases. Y'all haven't seen anyone who had it. So it's easy to say, what is that lady with the accent talking about? Like, please, honey, let me tell you, it's not a joke. Meningococcemia would take your kid out. And you don't ever want me to say, ma'am, oh my God, you know, if only. You don't want to say that. So please get your kids vaccinated. And you know what, teens? Once you hit 18, go ahead and do it. Go to your doctor at the clinic, at the university, or wherever you are in college. Ask them to check your shot records. Demand that you get the vaccines that you deserve. Because when you catch it at 18, it's a different entity, because I'm talking to you as an adult. Now, if your mom or your dad doesn't take you at 11, that's kind of different. I'm talking to your parents. But for you, once you turn 18, or if you're lucky and you're 17 and you're emancipated, you join the military, you have a kid, you're living alone, go get your vaccines. You can sign for yourself. You can go get your vaccines yourself, okay? So meningitis, not a fun bug to catch. You don't want to play with it at all, okay? Next one will be, let me see. Next one will be the chickenpox vaccine. So I had chickenpox. I guess if you've had chickenpox and you know it, raise your hand. Let me see. Has anyone who's watching me had chickenpox? Hi, Glenn, how are you? Has anyone who's watching me had chickenpox, heard about chickenpox, seen a patient with chickenpox? I had chickenpox when I was younger. I think my mom made a joke that every disease that I wrote a letter, I basically received the letter, because I had chickenpox, I had mumps. I don't think I had measles, but I know I had chickenpox and I had mumps. So Diane says she had chickenpox. Yes, she says, me. Luckily for those of us who've had chickenpox, for the most part, you don't really have to get the vaccine, because it does confer on you a lifelong immunity. However, when you get older, you might get zoster. So we'll talk about that for the elderly. But certainly if you've had chickenpox before, it's a relatively mild illness. When you catch it as a child, you get those funny looking, what they call like teardrop looking poxes on your body. You pop them and they're different stages and they eventually heal. You might get a scar or two. You're generally fine. You're generally not sick. It's a viral infection. You don't do too badly with chickenpox. But if you get chickenpox as an adult, as a teen, is a whole nother ball game. So you do not want to get chickenpox, babies, not if you're older. So again, teenagers who are in college, go on to your clinics, ask to look at your vaccine records. And if you don't see a record of something, assume you didn't get it. This is one of those times that if it ain't there, you didn't get it. Just go ahead and get it. Better for you to get a double dose of a good thing than none at all of a good thing, right? So please go ahead to your clinics, ask about your shot records, ask your parents to send you the shot records. If anything is missing, just get it. It's just a needle. I know, I don't like needles. Trust me, you should ask my clinic people. I'm the biggest chicken. But by the time they hold me down and everything, I eventually get my anthrax shot. So please get your vaccines, teenagers, okay? Let me see. So chickenpox, usually we give it to kids 13 years or older who've never had it before. They get 2 doses of, I think it's about 6 weeks apart, a month to 6 weeks apart. So you get your vaccine and you're set, okay? So the next one is the measles, mumps, and rubella vaccine. So let me see. Diane says she had chickenpox but didn't retain antibodies, so she had to have, thank you, at 38. Holla! So Diane got a chickenpox vaccine at 38. So that's why I said a lot of times it does confer lifelong immunity, but not all the time. So thank you, Diane, for sharing that very powerful testimony there. Let me see. Ellis had a severe case of chickenpox. One was infected in her throat or on a lymph node in her neck, and they almost did a tracheotomy. Oh my God. And she was in isolation at Bellevue at 4 years of age. Oh, poor thing. Ellis, thank you for sharing your story. This is why I do what I do, right? So I know it's really meant for teenagers, but I'm so glad I'm able to get audience participation and people are able to identify if they got it or not. Yeah, so for the most part, chickenpox is a mild virus, but it can be severe, especially if you're immunocompromised. I don't want to go into all that detail. Like if you have other things like sickle cell disease or, God forbid, you have cancer, leukemia or something, you do not even want to smell the virus because then it's going to take you out. So yes, that is true. So thank you for being here because I will have never had a chance to meet you, Alice. I'm so happy to hear it, to read your story. Let me see any more testimonies out there. None. So let's keep going. Okay, so yeah, so we've talked about a few vaccines. So if you're just joining us for the first time, we're talking about teenagers and vaccines. If you have a teenager, please urge them, if they're in college, urge them to check their shot records, ensure that they do have the immunization on their records, that it's documented. If it's not documented, assume it wasn't given and just go get it, okay? So we talked about chickenpox. Oh, I think we were talking about measles and then I got distracted. Forgive my ADHD, it's who I am, okay? So measles, mumps, rubella. I got mumps, did not get measles, did not get rubella. Rubella for the most part is a mild viral infection. Doesn't usually cause too much drama. You get a little spot here and there and it's usually over. But if you're a pregnant woman, and we have teenagers who get pregnant. If you're 16, 17, 18, 19, young adult, you've never had a rubella vaccine before, and you get rubella, I'm here to tell you that your baby might be in serious trouble as a result of that. So on the one hand, rubella is a mild disease, It's just a mild virus, you get a little rash and it's fine. But if you're pregnant, rubella turns deadly for your little infant. So please get immunized, get your MMR, okay? The first time we give MMR is usually at the age of 1 in America, but I believe we give measles at 9 months in Nigeria. So different countries, different continents may have different immunization schedules. Either way, just get it. And I think we get it sooner in Nigeria because measles is so deadly. If you've ever seen a child who had measles, that is the most pathetic looking, sickly looking kid ever. They get these rashes, they get stomatitis, they can't eat, they can't drink, they get what they call laryngotracheal bronchitis, which is the entire airway is inflamed and they're just sick, they're coughing, lots of mucus everywhere. And of course, some of them succumb. And then they can't eat because they have stomatitis, so they get malnutrition. They might have kwashiorkor, they might get marasmus. It's bad for the children. And I know, luckily for us, the last measles epidemic, rather outbreak, which was about a month ago, it got to Texas. We had about 100 cases last time I checked. But knock on wood, I didn't hear much about it again. But that's just to tell you that this is 2019, and we're talking, yes, I know I said 19. And we're talking about measles outbreak in America. Like, seriously? Y'all, just get vaccinated already. Have them call me, okay? Just get vaccinated. Okay, so measles, my Lulu said, that's my dog, Lulu said, yes. So measles, mumps, rubella, you want to get that. I got mumps, not a fun disease. You get a swelling in your cheek, it hurts, you look kind of weird, it's ugly. And in Nigeria, they chew up raw corn and then they kind of spit it on it. Lord have mercy. Mama, why'd you guys do that? But anyway, let me see. Ram is here, Jude is here, Angela Finn is here, Luis Rohina is here. Welcome, welcome, welcome. We're talking about teens and vaccines. So back home, that's kind of the weird way to treat mumps. Now, why do I want to talk about mumps? I'm talking about mumps because, yes, another relatively mild disease to get if you get it as a child, but if you get it as a teenager, I have some bad news for you guys. Men, yes, that. It can cause you to have no people and no little people in the future. So if it affects your testicle, you can get some really bad outcome. So again, mumps, like nothing, right? But you don't want to get it as a young teenager or as an adult because it can cause some really, really bad things down the line. I've pretty much said what it is that I wanted to say. It can cause what we call orchitis or testicular orchitis, and it can cause you to have low sperm count in the future and you have no babies. And you can say Dr. Ume warned you, Dr. Lulu warned you, either one, okay? So please remember that. You want to get your measles, mumps, and rubella vaccine. So like I said, we give 2 doses, one usually at the age of 1 and then again at 4 when they're going into school and when they turn 11 or 12, okay? You want to get, that's my middle school vaccine. So last but not least, the last vaccine, the one and only HPV. So HPV is about a little over 20 years old, I think, the vaccine, and it stands for human papilloma virus vaccine, so HPVV, if you want to say that, or Gardasil is the big name out there. There are a couple others. The point I'm trying to make is I named this vaccine my seatbelt vaccine. I call it a seatbelt vaccine because I feel like before you start driving, what's the first and most important thing you do? You get in the car, of course, but then you strap on your seatbelt. So whereas this is not about sex, it's not about becoming sexually active, it is about cancer prevention. However, how do you catch it? That is why I say before you become sexually active, you want to get your HPV vaccine. You want to get your Gardasil. And if you don't believe me, anyone who's got a computer, which you all do, log on to, I think it's hpv.com. There's a commercial by Merck called Mom, Dad, Did You Know? Everyone should watch that Did You Know ad because it has so much information. It talks about how a girl, just a happy girl, you know, black, white, whatever color, boy, black, white, whatever color, otherwise healthy looking, has cancer. And I had the benefit of attending an HPV conference, I think it was a week and a half ago, where I gave a little impromptu talk. And we had a girl share her story. She was 26 years old at this time. And she caught this virus, we don't know when, and she actually had cancer. She's had to have radiation. She's had to have all kinds of things. I mean, she was describing how she was bleeding and she was anemic. She was very sick. Luckily for her, knock on wood, she's cancer-free for about 18 months now, but it's still cancer. And you know what? She did share with us that she was a child of, I think, Catholic family, and her parents didn't really know about the vaccine, so she was not immunized against it, but she caught it. She caught it. So, You can immunize boys as well as girls against HPV. The CDC recommends you can start at the age of 9. Have I given a 9-year-old before? Yes. Do I prefer that? No, I prefer 11 because that's when you come in for your other middle school shots. So I usually give it together with the tetanus like I talked about, the meningitis and the measles and all the others that we talked about earlier. So I give it to you usually between 11 and 12 years of age. Not because you're going to become sexually active, which is what I think most people don't understand, because maybe we as providers have failed to emphasize on the cancer prevention reason of the vaccine versus focusing on the sexually transmitted disease part of the vaccine. However, the good news is because there's been so much noise about the vaccine out there, cervical cancer rates have actually started dropping. I know the Nigerians that are watching me, let me see if anyone might know someone who has had cervical cancer. I had a classmate whose mom had cervical cancer and she died. I remember actually 2 classmates whose one was a mom and one was an aunt, and they both died of cervical cancer. Very, very, very common in Nigeria. And I can speak about that because I know about that. But yeah, very, very common. So let me see. Hope Alexander has joined us. Princess Adora has joined us. Welcome, welcome, welcome. Hi, Hope. And we're talking about teenagers and vaccines today. So please, please immunize. So the HPV vaccine, I call it my seatbelt vaccine. So I say you put your seatbelt before you start driving. You get your HPV vaccine before you become sexually active. Not because I'm preaching against sex, because I'm here to tell you guys, I don't have to preach about it. Your kids are going to do it if they're going to do it. I have nothing to do with that. I'm talking about the fact that this vaccine prevents cancer. You're going to buy me my Michael Kors bag, my Louis Vuitton shoes, my fancy Michael Kors watch. I just want the vaccine, which for the most part is free. Who gets it? 9 to 11 and up to 26 years of age is the cutoff recommendation. But I've heard that people older than 26 can get it. I don't see you as a doctor if you're 26 anyway, so I don't really know about that. But I do know my kids, my patients in my practice, I do insist that they get the HPV vaccine. So hopefully I've been able to convince all of y'all who have been on the bench about the need to get your HPV vaccine. I've been able to convince you guys to get vaccinated, period. You guys have been awesome. Thanks for the interaction. Please, if this video helped you in any which way, switched on a light in any which way, share it. Share it. Don't keep the good news to yourself. Tell folk about it. Start talking about it. That's the whole idea why I'm doing this. Start talking about these things that no one wants to talk about. Start talking about it. Talking about vaccines, talking about teenagers and drugs and sex and all that. We'll get to that later on. And of course, depression and suicide, right? So if you need a teen expert to speak at your event, holla at your girl. I'm so excited to announce that my website went live. Thank you guys so much. I've gotten a bunch of visits. Don't forget to subscribe while you're on there visiting. It's called teenalive.com, www.teenalive.com. And as usual, I'm available every Sunday at 2 p.m. on Ask Dr. Lulu for another very interesting topic about teenagers. Otherwise, I'm on LinkedIn, I'm on YouTube. I have a YouTube channel. Basically, my videos are there. So if you can't watch it here, just watch it on YouTube. And I also have a link to my videos from my website. And I'm also on Instagram. I should be more active on that, but oh well. And my blog, of course, my www.blackbutterfly.blog, okay, or wordsbyblackbutterfly.com. So I will see you guys next week, Sunday. I do have an announcement, though. We're going to start something called Wellness Wednesdays. That's all I'm going to say for now. Okay, that's all I'm going to say for now. And I'll keep you guys kind of guessing. So Miss Titi, if you're watching me, wink, wink. Okay, so on that note, I'm going to say goodbye. Let me see if there are any more questions. No more questions. You guys have been awesome. Thank you all so much for sharing your stories with me today. It's been fun as always. It's Dr. Lulu. I'll see you guys next Sunday. Peace.